Isoniazid. Submitted by BP 1650225, Sayyida Fizza Jafar. Isoniazid is also known as isonicotinic acid hydrazide. It is an antibiotic used for the treatment of tuberculosis. For active TB, it is often used together with rifampicin, parazinamide, either streptomycin or ethambutol. Other names of isoniazid is INHA, isonicotinyl hydrazide. Its metabolism through liver cytochrome P450 and elimination half-life is 0.5 to 1.6 hours. Indication for isoniazid is that USP are recommended. Isoniazid tablet USP are recommended for all forms of tuberculosis in which organisms are susceptible. However, active TB must be treated with multiple anti-tuberculosis medication to prevent the emergence of drug resistance. Pharmacokinetic is that it has been used to treat and prevention in both adults and children when given orally and in fasted state. It is rapidly absorbed with the maximum concentration of about 1 to 2 hours post-dose. Food usually delay and decrease the extent of absorption. Contraindication: it is contraindicated in hepatic injury, drug fever, chills, arthritis, acute liver disease, and pregnant and breastfeeding women. These are some drug interactions of isoniazid. Adverse effect: when it affects the CNS, it causes peripheral neuropathy, toxic encephalopathy, and optic neuritis. In GIT, it causes nausea, vomiting, and epigastritis, and in liver, it may cause hepatotoxicity, jaundice, acute or fatal hepatitis, and bilirubinemia. These are the dosage which are available for adults and infants, children. These are some brands available of isoniazid along with their strength. Now we have alternative choices with the reason. Rifampicin for 3 to 4 months may give quite similar results to isoniazid for 6 months in preventing TB. By this may cause fewer side effects as treatment period with rifampicin is shorter, so more people completing their treatment. Two other drugs combination like rifampicin plus isoniazid and rifampicin plus pyrazinamide did not differ in preventing TB as compared with the isoniazid alone, but they result in more side effects. The third combination of rifampicin plus isoniazid supervised weekly for 3 months, and it is effective in preventing TB as self-administered isoniazid for 9 months. So it increased the treatment completion and caused less liver toxicity. These are some brands which are available of different pharmaceuticals along with their prices. Now we have the case study. We present the case of a 65-year-old lady with a weight of 80 kilograms and height about 150 centimeters, Sri Lankan black woman, known to have LTBI, treated with isoniazid and dyslipidemia. She was diagnosed with LTBI based on the positive purified protein derivative test. The patient's main indication for LTBI treatment was from past 6 months from a high prevalence country. She presented to the emergency department with epigastritis and right-sided flank pain of 1 week duration. The history goes back to 1 week prior to admission when the patient started to experience pain along with 1 episode of vomiting and dark urine like tea-colored urine without any urinary symptoms. She reported a severe pain which is relieved by sitting and lying forward and worsened by lying backward. The patient denied any nausea, diarrhea, constipation or fever prior to presentation. So come to the subjective, and in subjective we have symptoms which is pain, conjunctiva, epigastritis, tenderness, ecstatic sclera. Patient complaint is severe pain with vomiting relieved by sitting and lying forward, and when lying backward it worsened the pain. Past history is LTBI from 6 months and dyslipidemia. Pertinent review is that epigastritis, tenderness, and current medication she is using is paracetamol 500 mg per oral as needed, atorvastatin 10 mg once daily, isoniazid 150 mg once daily. She is neither a smoker nor alcoholic. In objective, we have she have blood pressure of about 120/78. Body temperature is 36.2 degrees centigrade. Heart rate is about 83 beats per minute. Respiratory rate is 15 beats per minute. In physical examination, we can see pale conjunctiva and epigastritis tenderness. Lab results show confirmed hepatitis. So by this we have the assessment that patient is suffering from hepatitis, which is induced by isoniazid, as it is given without monitoring and cause a liver damage. Now come to the plan. The plan is patient should admitted to the hospital for further investigation. Isoniazid should discontinued and followed this medication. Ketoprofen 100 mg IV every 8 hourly as needed for pain. Esomeprazole 40 mg IV once daily, and Buscopan 1 ampule of 20 mg for abdominal pain. LFT and different tests are also carried out for more investigation. Isoniazid should be substituted by other alternative, which should be continued after 1 week of recovery. So here are some references. Thank you so much.